Aloha! My name is Dave Giard. Welcome to my College 100 Foundations of Online Learning presentation. Take a moment to think about all of your friends and family. Would it surprise you to know that 1 in 5 adults are currently suffering from some kind of mental illness? Education-wise, I started with an associate's degree in criminal justice and am currently pursuing my bachelor's in psychology. Psychology is a very diverse degree to have and provides many different career paths following completion. I'd immediately like to look at the difference between psychology and psychiatry. Now, a couple of things to keep in mind. Psychology is the study of the human mind and its function, especially that affecting behavior in a given context. Psychiatry is the study and treatment of mental illness, emotional disturbances, and abnormal behavior. The big difference in treatment comes from psychologists relying on psychotherapy, aka talk therapy, to treat problems. Psychiatrists use talk therapy or psychotherapy as well, but they also can prescribe medication as fully licensed medical doctors. Salaries for both are considered very high. Psychologists in 2016 earn an average of $95,710. Psychiatrists over doubling that. In 2016, the average psychiatrist earned $200,222. Both require substantial education. Psychology requires a doctorate in philosophy or a doctorate in psychology, while psychiatry requires a medical degree. I have decided to complete my career interest presentation on psychiatry. The reasons being, I want to help people, I see a huge unaddressed problem in society, I think I excel with the skill set required, and I believe I can make a positive difference. Psychiatry is an ever-expanding field which will allow me to help others both domestically and internationally. In history, very little was known about the mind. Mental disorders and people with them were often considered supernatural and sometimes even possessed. Psychiatry was first formally defined in 1808. Modern-day psychiatry began in the early 1900s. It has now progressed to an extremely effective practice at ridding patients of mental health ailments. Psychiatrists are trained in medical, psychological, and social disciplines. They test psychological state of patients, administer therapy and/or medication to correct the problem. In one word, they are helpers. Psychiatrists' work environment is typically in a hospital, mental health facility, or a private practice. They usually work normal hours, but they must be on call at all hours in case of emergency. Some reasons for getting involved are, less than 5% of people with mental health problems actually see a psychiatrist. There is also a lack of doctors who are practicing for the right reason. Personally, I am a good listener, I am compassionate, and I want to help patients. I believe I'd make an excellent psychiatrist. The typical path to becoming a psychiatrist starts with an undergraduate degree taking 4 years. Following is medical school, which takes an additional 4. After that, you must complete a psychiatric residency for 3 to 5 years. After obtaining licensure, you can practice, at first supervised and then on your own. The field of psychiatry is growing very rapidly. This is partially attributed to growing populations, more affordable mental health care, and the destigmatized attitudes that mental health problems are something that should be conquered on your own means more and more people are seeking the help of psychiatrists. In addition, our rapidly evolving society is actually creating new mental health problems. Developing nations are also requiring increased mental health care. The systems for mental health care are simultaneously undergoing dramatic transformations as the field attempts to meet population needs effectively and efficiently. Dr. Morgan. Psychiatry is practiced internationally and is considered an in-demand job in nearly every developed and developing countries across the world. New Zealand has placed it on its skill shortage list, where it is actively recruiting internationals. Qualifications are based entirely off of education. In conclusion, psychiatry needs my help. I can make a difference here or elsewhere, domestically or abroad, with care, compassion, and a very thorough education. Thank you for watching and listening to my presentation on psychiatry. Please find my works cited below.
Created using Powtoon.